I'm Dr. Sunil Gajare, a senior neurologist at Jalgaon, North Maharashtra. A little introduction about myself. I did my neurology training, my super specialization from NIMHANS, National Institute Mental Health Neurosciences. I passed out in 87 and I have been practicing here since 1988 with all facilities, EEG, MRI, CT scan, ICU, etc., in my own hospital. Now, today, being Epilepsy Day, I would like to give some advice to the patients and to the public in general. First and foremost, epilepsy is not the dreaded disease that it was supposed to be. Such terms as grand mal epilepsy and petit mal epilepsy, which were coined. Grand means big, mal means bad, big bad epilepsy, and small bad epilepsy. We don't even use those terms nowadays. What we use is seizures, and we diagnose the syndrome and we treat according to the type of seizures, the sex of the patient, the EEG, MRI findings, and ultimately the cost of the medicine and what the patient can afford. Now, whenever a diagnosis of epilepsy is made, we choose a drug, the right drug for the patient. The responsibility of the patient is that he or she has to take the medicine for a long time. By long time, it's usually 2 years since the last seizure. Sometimes the seizures are difficult to control and the treatment may go on for 3 years, 5 years, and in rare cases, even lifelong. And in those cases where it's very, very difficult to control, there are other things such as epilepsy surgery. Now, this is point number one, that the patient should never forget to take his medicines. The other members of the family are encouraged to see that the patient takes the medicines in whatever dose the doctor has prescribed. Usually it's twice a day, sometimes once a day, sometimes thrice a day, but the patient has to take it. That is number one to success for treatment. Number two is if the patient has any problem with the medicine, such as any side effect, the patient has to realize that the side effects are never permanent. He has to go back to his or her neurologist, discuss with them, and either reduce the dose or change the medicine or whatever the doctor advises. The third point is regularity in treatment. Besides regularity in treatment, regularity in visits to the clinic. Whenever the doctor calls you for a visit, for a follow up visit, you must come so that the doctor assesses whether your fits are under control, whether the medicine is working, whether there are any side effects, and in general, the health of the patient. That is the third thing. Next is about polytherapy. That is, since the treatment is for a long period, we usually give a single drug because the less the number of medicines, the less the cost and the less the side effect. The more the number of medicines, more the cost and more the side effects. So as far as possible, we try to treat with a single drug, but it's not always possible, and then we may have to add a second drug or a third drug and so on. After that, epilepsy is a disease which is seen in infants, neonates, infants, children, adolescents, adults, and even old age. So, whenever we are thinking of epilepsy in females, the childbearing, pregnancy, lactation, all these issues come, and we have to choose medicines which will not harm the fetus in a pregnant woman. And pregnancy is planned so that the drugs are minimum, the side effects are minimum, and the child does not have side effects. The same way with elderly people, the tolerance to medicines is less. Perhaps the dose may have to be reduced in them. So, depending on the age of the child or the person, the dose is adjusted. Another thing is that if the patient has any other illness besides epilepsy, say a fever or malaria or enteric fever, the patient has to inform the general practitioner or the physician who's treating the fever or the intercurrent illness that he or she has epilepsy, and medicines which can provoke seizures should not be given, such as chloroquine in malaria, quinine in malaria, the fluoxetines, ofloxacin, ciprofloxacin, levofloxacin as an antibiotic. So that has to be informed. Otherwise, a patient is taking anti-seizure medicines. At the same time, some medicines which can provoke seizures are given, and then the patient has lost control of seizures. So intercurrent illnesses have to be dealt with properly. Then I've discussed pregnancy, I've discussed lactation, I've discussed old age. Then there's a special problem with children and neonates because there the causes of seizures may be different than the causes which occur in later age group. There the pediatric neurologist will usually choose the correct drugs. Then regarding the investigations in epilepsy, whatever the neurologist advises, the investigations have to be done because they give us a lot of information, especially the electroencephalogram or the EEG. It tells us what kind of drug to choose. It tells us whether the seizures are of a genuine nature or there is something called as functional seizures. It gives a lot of information, and we do the EEG. And also at the time of stopping medications, the EEG is very useful. Regarding stoppage of medicines, they are never stopped immediately. If a patient has not had seizures for 2, 3 years, the EEG is normal, the neurological examination is normal, the MRI is normal, we start reducing the medicines slowly, and then we stop it over a period of 6 months to even a year. The slower you go, the better it is. These are some of the things that we advise patients of epilepsy. Then the other things are that if epileptic patient does not sleep properly, lack of sleep can precipitate seizures. So the epileptic patient is told to sleep regularly, get adequate sleep. Sleep hygiene is very important. Next is about food. The epileptic patient should not remain hungry. Hypoglycemia or remaining hungry can precipitate seizures. These are two other things which we tell the epileptic patients. Many epileptic patients are worried, they're anxious, they have anxiety, and that also has to be dealt with. Some of them are depressed. If they are depressed, then they will need proper counseling and even antidepressant medicines or a change of anti-epileptic drug where the anti-epileptic drug also has antidepressant properties. That's another thing. Then regarding marriage, for both males as well as females, epilepsy definitely has a stigma. So girls who have epilepsy, if they disclose that they have epilepsy, they may have difficulty in getting married. The same with boys, if they disclose that they have epilepsy, they may have problems in getting married. For these people, they have to be counseled. The prospective bridegroom or the prospective bride who's getting married to an epileptic has to be told that it's usually never genetic. In very rare cases of epilepsy, they are genetic. The children would not have epilepsy, and marriage is definitely possible. The same with people regarding a job. They may have difficulty in getting a job because of epilepsy. There also, they have to be counseled that except working near machinery or a hazardous job, they can definitely do most of the work that other people can do, office work and other higher level work such as executive functions and such things. So, marriage, job, pregnancy, women with epilepsy, elderly people, lactation in women, children, neonates. I have discussed many of the broad issues. Another thing we advise the epileptic patients is that they are encouraged to take exercise, but at the same time, we don't allow them to do swimming because if they are swimming and they get a seizure, then they would drown. So, swimming is usually not advised for them. Regarding driving, well, if an epileptic is well controlled and the neurologist has certified that he or she is fit to drive, they can drive because many jobs require driving. And in Western countries, especially driving, unless you can drive, you're really handicapped, more so in the United States or Western countries where public transport may not be easily available. So I think I have covered a lot of do's and don'ts for epilepsy patients. And I will give my email address. It is S underscore Gajare, Gajre, S underscore Gajre at hotmail.com. So if you have any questions, you're free to ask me. You can send your questions online and I will be happy to reply to them. Thank you. And at the end, I would like to say that about 60 to 70% of epileptics get controlled with a single drug. At least 60% do get controlled with a single drug. Another 10%, up to 70%, would get controlled with more than a drug. And it is only the remaining one fourth which may require many drugs or surgery or so on. But more often than not, they can almost lead a normal life. And some great epileptics who have done well in life, we can go down history. Socrates was one of them. Then in the cricketing world, Jaunty Rhodes, Tony Greig, they are epileptics. Then we have Vincent van Gogh, the great painter who was an epileptic. So epilepsy should not be a handicap. It should not be a stigma. Just like you have any other illness of the body, this is an illness of the brain. It is not due to any external spirit or external black magic done on the patient. It's an illness of the brain. It needs to be treated well and correctly, and most often than not, the patients can lead a normal life. Thank you very much.